Hello, and welcome to the CMS National Training Program podcast, brought to you by the Centers for Medicare and Medicaid Services, or CMS. We're here to help our partners and the public better understand CMS programs. The information in this podcast is not legal guidance or intended for press purposes. Official Medicare program legal guidance can be found in the relevant statutes, regulations, and rulings. With that said, I am your host, Michaela Wright. From time to time, CMS gets questions about various topics, and today we'll answer a few of those questions with the help of Daniel Simmons, our Medicare specialist. Welcome again, Daniel.
Thanks, Michaela. Good to be here.
Today we're covering questions about coverage and claims under Medicare Advantage plans.
Great. Let's dive in.
All right. Someone asked, what if I have an MA plan and my doctor bill is higher than expected, or my claim is denied?
There are a couple reasons these things might happen. When you join a Medicare Advantage plan, in most cases, you must use doctors and other providers who are in the plan's provider network for the plan to pay your claim at the highest allowed amount and save you the most money out of pocket.
That makes sense.
Your claim might be denied because your doctor is no longer in the plan's network. Certain types of plans may allow you to see out-of-network providers, but usually at a higher cost.
Why would a doctor no longer be in the plan's network?
Plans are allowed to make changes to the providers that are included in their network. Also, doctors can decide not to be a part of the plan network. Either way, the plan is required to notify you about changes to their provider network. And if the MA plan makes a significant change to the network, in some cases, you may be able to change plans.
What about cases where your doctor is in your plan's provider network, but your claim is still denied?
There can be other reasons a claim is denied, like a particular service not being covered under your plan, or it may be that the doctor's office just made a simple coding error. For any service that's covered under a Medicare Advantage plan, you have a right to appeal the plan's decision if services are denied.
What if a service or claim is still denied even after a favorable appeal decision?
If you file and win an appeal but still have trouble getting the service or getting the plan to pay for it, there are several possible reasons. There could be an internal delay or an error in processing the appeal approval. To follow up, check with your plan first. And if you still have questions, contact 1-800-MEDICARE or your local state health insurance assistance program, also known as your SHIP office.
That's good to know. All right. Last question. My Medicare Advantage plan includes dental benefits, but the plan doesn't pay as much as I expected it would.
When it comes to Medicare and dental benefits, people often have lots of questions.
Okay, now why is that?
Well, original Medicare doesn't pay for routine dental care, dentures, and other dental services. It only pays for medically necessary dental care, like pulling teeth before radiation therapy for bone cancer of the jaw.
Got it.
Many MA plans offer limited dental care, which doesn't cover all services. Some plans have dental allowances. You might think you have full dental coverage, but you'd still get bills for dental services.
I can see how that could happen. What should people do in that case?
Check with your plan to find out what's covered. You may be able to buy additional limited dental coverage through your MA plan and pay an additional premium. Additionally, you can buy a dental policy from an outside insurance company. This is private insurance, and CMS doesn't have any jurisdiction over these policies.
Very helpful. Thank you, Daniel. We appreciate you weighing in on those questions about Medicare Advantage coverage, claims, and appeals.
You got it. Always happy to help.
This concludes our series on this topic for the CMS National Training Program podcast. Thanks for listening. You can find out more about Medicare Advantage coverage, claims, and appeals at medicare.gov. And visit the CMS National Training Program website for more training opportunities and resources. Remember, stay healthy and stay informed.